Hi, Elizabeth. How are you today?
I'm good. How are you?
Good. How have you been since I last saw you about 4 months ago?
Good. Still looking for a job.
Has that been stressful?
Yeah, but thankfully my husband's job's going really well.
How overall has your Crohn's been since I did last see you?
Very good. I haven't felt this good in a long time. Happy to be off the steroids.
Oh, yeah. I know we had a lot of discussion around how was the best way to get you off the steroids, the best therapy for you, and the Humira seems to be doing really well. So let's talk about some of the Crohn's symptoms. I just want to make sure that we're on par with what our goals are of managing you with the Humira. Are you having any abdominal pain?
No.
Any change in your stools?
No, my stools are pretty normal.
How often are you having going to the restroom daily?
About 1 or 2 times.
And what's the consistency?
It's very normal.
Any blood?
No, never.
Are you having any urgency, like the need to rush to the restroom?
No.
Great. Any nausea or vomiting?
No.
How's your weight been?
It's stayed about the same, and I have a great appetite.
And tell me about your diet.
Well, I'm trying to eat a little more healthy, staying away from eating a lot of greens, because I notice when I do, my bowel movements increase. So just eating a lot of protein and not a lot of processed foods.
Great. Any joint pains, rashes, skin or hair changes?
No,
How are your menstrual periods?
they're normal.
And when was your last menstrual period?
Last Sunday.
Are you on birth control?
Yes, but I'm thinking about going off of it because my husband and I are talking about starting a family.
Oh, that's fantastic, because last time we talked about it, before we started your therapies, we had a nice long talk about the importance of you being well before you started to even try.
Yeah.
So all I would ask is, because there's a lot that goes into the discussion around the timing of your medication, what medications you could stay on, I want you to come in once you stop the birth control pills so we can discuss what goes into preconception and planning during pregnancy.
Sure.
Speaking of your medications, because that's probably going to be one of the biggest discussions we'll have once you're thinking about getting pregnant, can we review the meds you're on today?
Sure. Humira, vitamin D, and yes for birth control.
And what's the dose of the vitamin D?
1,000 units per day.
And the Humira, is it once every 2 weeks?
Yes.
Great. Do you miss any doses?
No, I never have.
Do you have any breakthrough symptoms as you get closer to your injection? Do you know you may have some increased pain or your stools may change in consistency?
No.
And when you inject the Humira, do you notice any rashes or pain at the site of where you're injecting?
Well, it stings at first, but it's not nearly as bad as it was when I first started 9 months ago.
Okay. And where do you usually inject?
In my thighs.
Have you rotated sites at all?
Yeah, I've tried my stomach, and I actually think it feels a little bit better, so I think I'm going to switch from my thighs.
Yeah, that's not an uncommon comment we get from patients, because remember, you have quite a bit of muscle in your thighs, so sometimes possibly if you're hitting the muscle, it's much more painful. And so we want to get as much subcutaneous or fat underneath the skin, so that tends to soften the blow of the injection. So I'm glad to hear that you're rotating sites and that you found some solution to some of the pain you're experiencing. Otherwise, have you had any other changes in your body or your health that I need to keep track of here?
No.
When was the last time you had blood drawn?
Last week to prepare for today so we could review it, just
Okay.
trying to be proactive.
Great. So let me look. All right. So what I can see here, which is great, is that your CRP and your SED rate, or ESR, which are markers of inflammation, which were way up before we started the Humira and when you were on the steroids, have now normalized,
Oh, good.
which is fantastic.
Yeah.
And also your anemia has improved such that finally your hemoglobin is normal. Your inflammatory markers, the CRP and the SED rate, have finally normalized.
Oh, good.
Yeah, if you remember before the Humira, and I could show you what they were before the Humira, they were elevated. But that's a marker that you have inflammation, which we know, and that's why we went with the Humira. The only other thing is that your iron level was low.
Okay, so should I add iron to my usual multivitamin?
Yeah, 2 ways you can go about it. You can add an individual iron pill or try and find a multivitamin that has some additional iron. One trick is that in order to increase iron absorption, you may want to take it with some orange juice, which is some vitamin C.
Okay, sounds good.
And also, remember I've been having you do these stool markers. where you take your stool into the lab and we're looking for inflammation in the stool. Remember, that is really trying to get at whether or not there's inflammation in the lining, what we call the mucosa, which is where we saw the ulcerations at the time of diagnosis. And the great news is, compared to how it was, again, while on steroids and before starting the Humira, we finally have normalization of your stool marker.
Oh, good.
Yeah. That's great, but also we have an ability to now monitor your stool markers maybe 3 times a year, for example, and that'll gauge how your insides are doing in a way that if they start to go up, we may have to talk about why are your symptoms changing and whether or not we may want to change your medication regimen around a little bit. Also, if you recall, we talked about vaccines last time we were here. I told you that at the next blood draw, we're going to check whether or not you're immune to some of the vaccines, for example, hepatitis B.
Yes.
Because individuals who are on anti-TNF therapy or anti-tumor necrosis factor therapy, such as Humira, we would like them to be immune to hepatitis B. And you were not immune.
Yes.
So what I'll need you to do is talk to your primary care physician and let's get you set up to get revaccinated.
Definitely.
On the good news side is, going back to our live vaccine story that we talked about last time, is that you won't be able to get live vaccines when you're on the Humira. You are immune to the chickenpox or varicella.
Yes.
And that's great because while you're on Humira, we couldn't give you that vaccine. So you must have had chickenpox as a baby, I'm going to guess.
I did, yeah.
Also, I can't seem to find your vaccine record.
Yes, I'll call my primary care office to send over the vaccination record.
Yeah, because I think it's important to have that in your record because it's good for us to keep track. And, you know, we'd like to partner with the primary care doctor to make sure that you're just getting exactly what you need while you're on the Humira and make sure that your immune status is set. Also, when did you have your last colonoscopy?
Last summer, and it was completely normal.
So the question on when should we repeat your colonoscopy, which I know you're not anxious to go right now with that. So what we'll do is let's see how it goes relationship to the stool marker that we're going to be doing and also your plans for pregnancy.
Okay.
So I think when you come in for that pregnancy visit, we'll talk about whether or not, just to be sure before you actually start trying, that just like your labs are normal, that your insides are also normal. You know, I think it's important to start remembering that looking at your lining is really critical for you to stay well in a very durable state, you know, keeping you well, both you describing it to me symptomatically as well as your labs looking normal. All right, let's turn a little bit to more health maintenance now.
Okay.
Are you up to date on your flu shot?
Yes, I got the flu shot, but I stayed away from the flu mist per your recommendation because it was a live vaccine.
Great, and also your husband didn't get the flu mist, he got the
Yes.
flu shot, right?
Yes.
Okay, so anyone, as a reminder, in the household should be getting the injection and not the flu mist, given the fact that actually the flu mist stays in your nose for about 3 days. So the virus is hanging around, and that's why we don't want you to be getting the flu mist.
Got it.
And the pneumonia vaccine, remember when that was?
No, but it was definitely within the last 5 years.
Okay. Again, when I get that vaccine record, it will be really important. The reason why I'm asking about it is that there's this new vaccine called Prevnar 13. Babies historically got Prevnar 7. So this is a new vaccine that adds additional immunity to the pneumonia vaccine, which is called the Pneumovax. And if you've gotten it within 5 years, around the 5-year mark, you'd be due for your booster of the Pneumovax, which is the pneumonia vaccine. And the timing of the Prevnar 13 is really dependent on when you got the pneumonia. And that's why I'm really focused on you getting me that vaccine record.
Yeah, I'll give them a call.
Are you up to date on your tetanus?
Yes.
And do you think that was within the last 5 or 10 years?
Yes, that was definitely within the last 5 years.
Because you need a booster around the 10-year mark. So
Okay.
we'll just double check that. And when was the last time you saw your gynecologist?
Last June.
And you had your pap smear?
Yes, and it was totally normal.
Great. And your dermatology visit for your annual skin check?
That was last fall, and it was normal too.
Yeah, good. Just a reminder, when we talk about these annual visits to your gynecologist, to the dermatologist, it's really just to keep prevention, right? We want to be ahead of the game because when you're on Humira, for example, you may have abnormal pap smear, you may have abnormal, changes in your skin. So it's really important that we're very proactive and preventative. That's really the key. Has there been any change in your family history since I last saw you?
Nope.
So no new cases of inflammatory bowel disease,
No,
No other autoimmune diseases?
no.
Okay, great. So before I conduct a physical exam, is there anything I may have missed?
No, I can't think of anything.
Great.